Okay. My name is Gyulten Hyusein and I'm a PhD candidate in cognitive neuropsychology at Koç University in Istanbul, Turkey. And right now I'm a visiting PhD student researcher with the Fulbright grant at the Penn Center for Neuroaesthetics. So I actually have two studies at the PCfN, and both of them are related to my broader PhD project, which is about creative thinking and hand gestures. We are trying to understand the interplay between those two and the mechanisms behind them. So in my main project here, I am studying people with two types of dementia, which some of these skills that they are losing, they might be related to the mechanisms behind creative thinking and gestures. My second project, again, I'm focusing on creative thinking and gestures, but from a bit of a different perspective. So we are studying whether exposing people to pictures of objects or to the names of objects would affect their creative thinking, or more specifically divergent thinking, which is the ability to come up with many creative ideas. The research question, the hypothesis and the predictions, they are really important for the research process. So we spent quite a bit of time, like 2 or 3 months maybe, polishing those hypotheses and predictions. Like we know from maybe popular culture that they tell us body language is important, when you are giving a talk, for example, pay attention to how you use your hands. But I never knew the psychological mechanisms behind it. So how gestures, for example, sometimes they affect our thinking. They are so not only the listeners are affected by them, but we as the speakers, we are also affected by how we use our hands. For example, for gestures, I didn't know that I should care that much before I started my PhD. But the more I learn about it, the more I realize how important gestures are. I even realized in my first year of my PhD that I gesture a lot. I wouldn't notice that, but when we go into the room and I start testing them, I just become curious about which tasks they can do, especially with the patients, for example. Why can do that, then why can't they do them? And I think one of the most rewarding parts is at the end of the experiment, they find the tasks difficult, of course, but sometimes they also feel better after they do those tasks, and especially the patients, they feel grateful that we are doing research with them, so we are trying to understand their disease. The more answers I have, I also have more questions, which is, I think, part of research as well. Like, we end up with more questions than answers. Yeah, so the Fulbright, people, when I tell them, I'm on a Fulbright here, they are like, wow, and I'm like, I don't feel that it's very, maybe when you are part of it, you don't feel that the wow effect, and I would never think of coming to the US. But for this lab, I said, okay, that's worth it. Let's apply. I would really like to learn more about the research they are doing, to be part of their research, to learn from them. I came in with all the imposter syndrome, but even from the first lab meeting on, I didn't feel like an imposter or nervous, or I never felt not enough. If it was only sharing professional things, maybe then I would mostly compare myself to everyone else. So did I do enough? Did I not do enough? But when we share something personal, it also makes it more, again, like homey, or I don't know, more fun as well.
When are you doing that?
Yeah, we were. And also.
Yes, right.
But somebody should be like, I'm here and you are
doing
that.
Yes.
Do you want to do it?